My name is Renata Creed. I'm a family nurse practitioner and I specialize in skin for 27 years. Today, I would like to show you how to correctly perform an acne facials. If done correctly, your patient, your client will heal much faster, will have less blemishes and much less acne scars. Unfortunately, if done incorrectly, you may cause your client severe skin infections or long-term blemishes and facial scarring. So today, Sharika, my lovely client and friend, for last 12 years, 13 years, she comes over. She used to come 12 years ago, and I was able to correct her skin within about 4 to 6 months. She went through different life changes, and she started getting her hormones started getting imbalanced. So now we do a little different treatment for Sharika. We start doing the holistic care. We had to balance her hormones, so she has a special hormone balance routine. She's using topical antibiotic on a regular basis, and now she'll be able to use it sporadic because her skin is already in a better shape. I started treating Sharika about 6 months ago again, right? So this is her skin today. After 6 months, she comes every month, every 6 weeks for the treatment. So with Sharika, the reason I'm gonna work on Sharika today because treating skin of color client is a big challenge. The reason is their skin is very prone to blemishes and acne scars. So I'm going to show you today how to perform extractions correctly and which order you should do your facial to have the best desired effect. So first I'm going to do skin assessment, right? Like we do for every facial. So I'm going to look at under the light and check how her skin looks and what we're going to be treating today. And her skin looks so good comparing to what we had 6 months ago. I will show you pictures later, before and after each time she was here. So I see that I'm going to do some extractions, but I see that she has enough place without any breakouts that I can do a little bit of microdermabrasion. So that's what I'm going to do as well. If you have breakouts all over the skin, you cannot, I repeat, you cannot do microdermabrasion. In her case, you can see her skin is smooth, and we have several areas we can treat. Places where she has some breakouts, I'm gonna skip it. So let's get started. We finish assessments, let's do facial cleansing now. So as you see, she has some blemishes, but she doesn't have any, when I'm touching, she doesn't have any breakouts here. Not anyways the one they're active. So I'm able to go, I'm touching and checking the area before I go and do the microderm. Let's say this is a blemish, but let's say this is acne, I would go around. I wouldn't do it. If she has lots of acne, let's say like 2/3, half of the surface, I like spread out, I wouldn't do microdermabrasion because that would mess up her skin really bad. Here, so she has some acne here, some few spots here. So what I'm gonna do, I'm gonna cover them and I'm gonna go around them with microdermabrasion. You definitely don't want to go over your breakouts, and you just skip that area. Here is another one. Here's a little bit. So I'm going to be skipping. Skip here. She has few here. This one I'm skipping. So this is kind of how you work out your skin. Your peel is coming. This is the 10% acne treatment. It's a blend of 5 different acids: glycolic, lactic, malic, citric, and also some salicylic acid. For acne, I use 2% salicylic acid. For normal and dry skin, I use 0.5% of salicylic acid. So that blend works perfectly to remove dead skin, to kill some of the bacteria, and to clean skin, clean pores, shrink pores, and kill some of the bacteria, which salicylic acid is known to do. And we're gonna leave this treatment because we have a steamer. We're gonna use the steamer to reactivate this peel. So she is pretty much feeling a lot of burning sensation, nothing major. So Sharika, what would you say, like 1 to 10, how much, how intense is the treatment? What do you feel?
I feel probably at a 3.
Okay.
2.
So peel, it's a crucial part of the acne treatment at home and in your office. So you will ask client, how is she feeling? 1 to 10, 1 almost nothing, and 10 the worst pain, 1 like, or very, very uncomfortable, maybe not worst, but very uncomfortable, to know how her skin is reacting. Normal answer would be anywhere from 2 to 6. Over 6, you gotta watch. Maybe you have to rinse it earlier, the treatment. Okay, so now I'm gonna set her under the steamer for 12 minutes and let the steamer reactivate the peel, and then I'm gonna wash it off. So as you see, her skin didn't change, it's not getting red. If you see any like unusual burning, very red skin, then you gotta wash it off. You wash it off and you can follow with coconut oil or any cold press oil you have in your clinic to calm the acid down after you wash the face, if that would happen. Okay, so now we're gonna wash off the treatment, the peel treatment. Nice warm towel, and starting upwards, from up going downwards, from forehead, nose, all the creases,